Welcome back. This is Simon Nadeem. If you haven't met me before, I'm a nurse from Southeast England, and in today's video we are going to talk about writing mistakes that a lot of people make mistakes and they fail OET writing. This is all we are going to discuss in this video. This is the part 2 of the video I made before few days ago. If you haven't watch that video part 1, you can watch that video on my YouTube channel. And if you're a returning viewer, thank you so much for coming back and watching my YouTube videos. If you're new and you didn't subscribe, what are you waiting for? I provide information about UK nursing and process of becoming a nurse, each and everything around me. So if you're interested in these topics or you want to come to the UK, please consider subscribing. Let's dive into the video without any further delay. So in today's video I'm going to talk about and the punctuations, cohesions, letter writing. What are the mistakes that a lot of people make in letter writing? Also how to use since, for, ago, or where we need to use capital letters with the brand names or generic name of the medication, how to use abbreviations. So if you are interested in these all the things, we are going to discuss them in this video. Don't forget to watch the video till end so you can learn and pass your OET writing. First thing I want to talk about is the use of a, an, or the. All right, we need to use them for all the countable nouns. For the first time when we use them, when we write them, all right, then we need to use a and an. All right, when we use the countable noun, we need to write a or an, okay. But the second time when we use it, we need to use the. All right, it's very important, and a lot of people, they do mistake, they make this mistake and they fail the OET writing. So use of a and the is really important. You need to pay close attention to this. Mr. A went for a surgery yesterday, or went for an operation yesterday, okay, and then the second time then you use it, you need to say the operation was successful. All right, so this is a countable noun, an operation or a surgery. Then in the second time when we use it, we need to use the. Sorry for the noise. Another important thing that you need to remember is the use of the in front of all body parts. If you're writing, if you're talking about any body part, you need to write the. Exception is the fractured femur, a fractured femur. All right, but if you are going to write it a fracture of the femur, okay, if you need to write it like this, then you need to mention the, but otherwise you can say a fractured femur. Or you can say I sold some medications to Mr. Smith for his body pains. You need to use the or his, okay, for all the body parts when you are going to mention them in your in your letter, in your OET writing letter. You need to use the in front of body parts, or his or her in front of all body parts. You need to write the also when the people around you or the person you are talking to know what you are talking about. If they know the situation, if they know the thing, then you can use the. For example, if I say the fridge is not working, so whoever is here in my home would understand which fridge I'm talking about. Or I need to take the pill, so maybe if I'm talking to my husband, he would know that which pill I'm talking about, right? So if the particular knows what you, or they understood what you are saying, then you need to write the as well. You need to write the in front of all the superlatives. For example, the biggest, the smallest, the most effective medication. So a lot of people, when they write letter, they don't write the in front of superlatives, which can make them which can lead to a failure. All right, so you need to remember, if you are talking about anything smaller or biggest or larger or expensive or most reliable, so the most, okay, you need to say the most, the smallest, the largest. All right, so if you're talking about any superlative, you need to write the. It's also a big problem that a lot of people, they use unnecessary article use where they don't need to use. I mean, they use and the where it's not needed. And it's important that you know where to use the article. All right, so for example, if I say if someone says someone is complaining about a blood vein, so she say you write it, she complained of a blood vein. It's not correct. All right, a blood vein is uncountable, like water or advice, it's uncountable. So you don't need an article, you can just say she complained of blood vein. All right, I think a lot of people, they use the unnecessary where it doesn't where you don't need to use. For example, if I say a patient presented with the heart symptoms or with the heart disease, so you don't need to say that. If I'm using the noun first time, I can just say patient presented with the heart disease or with the heart symptoms. And the next time, then when you use it, you can say the advice about smoking cessation was given. Or I wrote some examples because with the baby it sometimes gets difficult for me to explain if I don't write it. So unnecessary article use, the patient presented with the symptoms indicating the heart disease, the heart disease. So we don't need to use the heart disease here. The first time you mention most nouns, they are still general. For example, heart disease or advice, so no article is necessary. But the second time, right, the heart or his heart disease is not responding, or the advice to give up smoking was not followed, because the noun then become particular. All right, when it becomes particular, it's understood, it's understandable, right? So the next thing I want to talk about is no joining words. It's a common mistake. A lot of people, they make this mistake. They don't use the words like furthermore, also, another one, or on the other hand, or no joining words. So, or moreover, moreover. A lot of people, they don't know that these words exist when they go for OET writing, and they fail the exam because they don't use the joining words. So if I'm writing, if I have written one paragraph and I want to include more information, I can start the paragraph with moreover or furthermore or in addition to, or what else did I write? You can also use yeah, in addition to, furthermore, or if you are writing more information for a similar information, you can use the joining words. They will give you higher marking in OET writing if you are using the joining words, and it's in the criteria also that you need to use the joining words. I'm speaking slowly because my baby is sleeping, I don't want to wake him up. We talk about joining words, writing as a result or consequently, these also comes in the joining words, and a lot of people don't write it. I mean, if something happened, if I give a tablet to a patient, what happened afterwards? So consequently, patient was feeling better, or as a result, his pain was resolved. Okay, so we need to use the joining words in our OET writing. Also, if we are contrast, if there is some contrast or we need to compare information, then we need to use however. Also, however is important. You can say that whatever the situation may be, I like using phone, however I don't use it a lot at night. So you can write, you can compare, you can contrast your sentences in OET writing. It's the best tip to use joining words and contrasting words. It's very, very important. Also, use of a and the, it's important. We have discussed it already. And if you don't know anything, you can practice. If you don't know how to use these words, you need to practice all of this. So in your paper, if you have a copy and pen in your hand, you can write use of the articles a, and the. You can also write joining words, what are the joining words and what are the words to contrast, however, but you can write it down, and what happens as a result, consequences, what were the consequences, I gave him the tablet, what happened afterwards, what were the consequences. You can write consequently or followed by. You need to write those words in your OET writing, guys. Also, You can also write no, there is also a mistake that people make: no joining phrases to summarize the letter. I mean, write in the view of the above at the end. If you are writing a letter, I think it's best to summarize it at the end, just to give a simple overview of what you have written. So you can just write in the overview of the above, or in the light of the above, or given the above, or in the last paragraph, as it brings the whole letter together and creates cohesion. So in the end, your last paragraph should include these words in the it's very important that you summarize your letter at the end. You can write as I said, in view of the above, or in light of the above, or considering all the facts, or provided the history. You can write these words, they are important. Mistake that a lot of people make is they don't use the simple present tense, which is very important. And if I'm giving some information about a current history of the patient, if I'm telling the reader of my letter that patient has this history, then you need to write has. Okay, you don't need to write she had a history of something. If the history is gone already, the history means a patient has this a condition, or if the condition is gone, I mean, or we can talk about had in the history that's being removed. I mean, if they have any surgery, they are not having the surgery, recurring surgery or something like that. So we need to tell them that if I'm telling them the patient still has the history, or patient has a history of high blood pressure, patient has a history of diabetes, then we need to use the present simple tense. You can write patient has the history, not patient had the history. Okay, but if I need to tell them about a surgery that patient had, then you can tell patient had the surgery. In my previous video, our first paragraph is very important. When I'm writing the first paragraph, I need to know that it should be, I need to remember in my mind, I need to consider that it should be without any mistake. Okay, in the first paragraph, a lot of people also make this mistake. They don't use present tense, they don't use present simple tense in the first paragraph. In the first paragraph, you need to tell them that what happened to the patient, I mean, what is the situation currently. Okay, and then why I'm referring this patient to you, what happened. All right, then you can see that, you can say that thank you for seeing Mr. A, who presents with. Okay, if I'm talking, I'm referring a patient, if I'm referring a diabetic patient to a diabetic nurse, I need to tell her that he's presenting with these symptoms, he presents these symptoms. All right, I'm not telling her that he presented the symptoms last year, or sometime sometime before in the history. You are telling about the current situation, so we need to write the present tense, simple present tense. Thank you for seeing Mr. A, he who presents with the high blood pressure, or who presents with the blood pressure, blood sugar, high blood sugar. You must use the simple present tense in this sentence, as the presenting complaint is the reason you are referring the patient. Yes, that is the reason we are referring the patient to the diabetic nurse. That is the reason we are referring our patient to another healthcare professional. That's why we need to use simple present tense in the first paragraph. The last consultation, for example, the last consultation is when the patient has X. Also, the last consultation is the date of the letter. So in simple, we need to use simple present tense in the first paragraph. Because we are telling the reason why we are referring the patient and what is the current symptoms. So you need to know when we need to use past perfect tense. If I have two incidents, I mean, something happened yesterday, and then yesterday he reported this thing, so then I can use past perfect. So I think in letter writing or OET or IELTS writing, the important thing is for you to learn the tenses, how to use them, when to use, and the most importantly is the present perfect tenses. All right, so if when where we need to use has, had, or have. Okay, and here I'm talking about a lot of people, they make mistake, they don't use the past perfect tense, they just continuously use past tense. So what is the difference? If I'm talking about something happened yesterday, that is past. So he presented to the hospital yesterday, that is past tense. Okay, when he complained, okay, let me give you an example. So for example, yesterday the patient reported the pain had worsened. So yesterday the patient said the pain had worsened, then we need to use past perfect tense. All right, reported was yesterday, so use simple past. The worsened pain happened before the reporting of the pain, so it is an earliest past, so use past perfect. I hope you understand with the example better. So in simple, we need to use past sentence for the for yesterday, and the past perfect if something happened before that earliest past. Okay, then we need to use past perfect. In simple, we are going to use ed for the past yesterday, for the yesterday, entered, happened, presented, and if something happened before that yesterday, or patient reported something that happened before that earliest past, then we need to use the past perfect. Where is had, that is had we need to use for the earliest past problem. So a lot of people, they don't use present perfect, which is very very important, and they fail the OET writing. What is present perfect? If something happened in the past that is connected to the present, then we need to use present perfect. Let's see an example. Use present perfect tense when there is a connection between the past and the present. For example, Mrs. Smith has had an uneventful recovery, so she'll be discharged today. So if there is a connection between past and present, we need to use present perfect. All right, I've given you just an example. You can write some sentences like this and practice them, and start writing them in your letter. Remember, we can also use a simple past if something happened but there is no connection with the present condition. I mean, if we say Mr. Smith had a fall yesterday, so there is no connection. There is no connection with the present about this. I mean, fall just happened and happened. It's not going to happen again. It can happen, but there is no connection between yesterday and today. If the situation, if something is finished, if something is done, then we can use past simple tense. We don't need to use the perfect tense here. Also a mistake that a lot of people make, that they don't write write the number agreement correctly. I mean, if I talk about two symptoms, a rash or a ankle edema, were noted, then we need to use were, not was noted. Some people, they write it like this: a rash and ankle edema was noted, or they write like a fever and a sore throat was noted. So here we need to write were. So number agreement is important if you are writing more than one symptom. Guys, you need to remember, in OET writing, you need to use the articles, you need to use the verbs, proverbs, everything you need to use. In, I know that in practical, when we write the notes in the hospital or at work, we just write it at in a note form. We can say that no remarkable history, or patient doesn't have any remarkable history, unremarkable history. But be careful, in OET writing, you need to write the full sentences. Okay, write full and complete sentences. For example, in a real word, I know we just write past history is unremarkable, but in OET you need to write the patient's past history is unremarkable. Yes, yes, in simple, in practical, we just write patient history is unremarkable or patient past history is unremarkable. But here, if we are talking about the patient, we need to tell the examiner which patient we are talking about. So in first paragraph you write the patient name, then you follow with his past history or the patient's past history. So as I explained in the beginning, we need to use the articles and the. They are very important, and make sure you write the complete sentences, not in a note form. People, they don't use and in the last item in the list. For example, if I say patient has nausea, vomiting, and a rash, okay, so in the last item, before I put the last word, last symptom, I need to use and. A lot of people, they forget it, they just write like patient is having nausea, vomiting, fever, constipation, okay, they don't use and before the last word. So it is important that you use and before you finish mentioning your last symptom, okay. So patient reported headache, painful joints, nausea and vomiting, okay. So using and in the last for the last item in the list, it's important.